Morning, Shelley.
Morning, how are you?
Way better today than I was yesterday. It's a lot warmer out there.
Yesterday
Morning,
was,
Wes.
I didn't think yesterday
Morning,
was
everyone.
bad. Yeah.
I actually prefer the cold.
I don't know, Natalie. My morning started off yesterday with my daughter's car not starting, and I had to run to Costco and get a new battery and put it in for her. And oh my gosh, what a samaj to the more. My hands didn't warm up until 2 hours later.
We only had one day like that, and it was -30, and our van wouldn't start.
Oh yeah, no, lots of people like that.
Yeah. We were out at the cabin over Christmas, so our neighbor just came and boosted us the next day. It was great.
Oh, that's good. Yeah. Well, the challenge is when the daughter car doesn't start, then it's like somebody's got to go and pick up the kids after school at the bus stop, and then she needs a ride to work, and it's just
No, we had nothing to do.
Yeah, right. Yeah. We're glad to be able to be here to be able to help, but like I said, my hands took 2 hours to warm up. You have lots of snow out at the cabin, Natalie?
Oh yeah, tons. There was a lot out when we were out there last week.
Where's your cabin?
It's I don't know, about an hour southwest of here.
Oh yeah. At a lake or just a cabin?
No, just middle of nowhere. It's great.
Oh, that's good.
When I say neighbors, I mean like I think we can see the lights of his house at nighttime. It's pretty quiet.
Madam Mayor, Wes here. I just want to inform you, I kind of got dueling meetings here, but I certainly want to hear Sikora's briefing. But if you don't mind, I'm going to go off camera.
That's fine, Wes, and he's not coming till 10.
Okay, fair enough.
So if that helps, yeah.
Thank you.
Sure. All right, 9 o'clock, guys. My new emergency management committee is who? I know, Shelley, you're on it, right? And Mike. Okay, the 3 of us. And so Natalie, Wes, and Ken are here just for curiosity's sake, but I welcome you. So I'll call the meeting to order. We got full attendance at the beginning of the meeting. I need a motion to adopt the agenda. It was sent out and it was attached to your calendar invite. So either Mike or Shelley, can you guys make a motion? Mike, you're muted.
I can do it if you'd like.
Okay, thanks, Shelley.
Okay. That the January 11th, 2022 Emergency Management Advisory Committee meeting agenda be adopted as presented.
Awesome. Thank you for that. Call for the vote. Hands up is good enough. Just 3 of us, Shelley. So yeah, that's unanimous. All right. Neither one of you were here for the last meeting, and I can't make a motion, but I didn't see any issues with the minutes. Ken, did you see any issues with the minutes? You were there. Okay. Shelley or Mike, full confidence that the minutes are accurate. Can one of you make a motion?
I can do it again.
Sure.
Okay, that the June 25th, 2021 Emergency Management Advisory Committee meeting minutes be adopted as presented.
All right, call for the vote. And that's unanimous. Okay, so we always start our emergency meetings with an operations center update, and I'm assuming Percy's with us. Yeah, there he is. Hi, Percy. Are you in your new digs at Fire Hall 1 yet?
Nope, not yet.
When do you expect to be there?
Well, that's a moving target, so we'll see. It's kind of handover is expected kind of end of the month at the current time. So we'll see when it truly happens.
Yeah, exactly. I thought you might be the lone person in there. But anyway, take it away with your update.
You bet. Well, good morning, Mayor Herron and councillors. Really, we're here today to provide you with a bit of a situational update, information on the Emergency Operations Center activation. Ryan Stovall will add human resources impacts, and then we'll discuss some information on business continuity planning. We have Dr. Sikora, who is the lead medical officer of health from the Edmonton zone, attending time specific at 10 a.m. with an update from health's perspective. And we also have additional directors available to answer your questions during this time as well. Oops, and I'm just going to put up my slideshow here because I've got some stuff to share with you here as well. There we go. And hopefully that's showing up on your end there now.
Yeah, we can see it.
Perfect. So really, the current situation with the COVID-19 Omicron variant has seen increasing rates of transmission across the country. Rates have been seen to double every 2 to 3 days. Yesterday, the US CDC advised Americans to avoid travel to Canada due to rising COVID caseloads. Canada was classified by the US CDC at level 4 or very high risk destination due to COVID. Last month, the Canadian government also asked individuals to limit non-essential travel. The federal government this week also announced an additional 140 million rapid tests heading to the provinces. Prime Minister also announced that there are sufficient vaccine doses to provide all eligible Canadians a 4th dose if required. Across the country, differing methods are being utilized to reduce the spread of COVID and reduce impacts on the healthcare system. Ontario has closed restaurants, bars, food and drink establishments. In addition, they've closed indoor facilities for sports, recreation, and fitness activities with limited exceptions and conditions. Quebec has closed bars, taverns, casinos, and restaurants. Quebec has also closed all indoor public events and indoor tournaments or competitions. British Columbia has reduced indoor event capacity to 50%, and everyone in attendance must be fully vaccinated. Also, individual and group fitness or exercise activities are not allowed. However, indoor sport recreation programs remain permitted there, provided they do not exceed 50% occupancy of the space. Alberta, on these graphs that you see in our charts in front of you, has the 3rd highest case numbers in the country, behind Ontario and Quebec, and the 2nd highest active case rate per 100,000 behind Northwest Territories. The Alberta data is January 9th data that was presented yesterday. Provincially, the Chief Medical Officer of Health meets with municipalities on a regular basis, continuing to provide information and answering municipal questions on implementation of orders. With Omicron, the CMOH has advised municipalities to be prepared for 30% of the workforce to be away from work with COVID at some point during the next month or so. The trends they've seen also from other locations have shown a doubling of that active cases every 2 to 3 days. The provincial restriction exemption program continues to allow participation in cultural and sporting facilities and has kept restaurants open in Alberta. The reliability of provincial data has changed with the addition of rapid testing as confirmation of positive cases. Provincial data only includes PCR tests in active case counts. This means the numbers should be looked as indicative of what's occurring. It has been estimated in some jurisdictions that actual COVID case counts could be 4 to 6 times higher than what's actually reported. Yesterday, the CMOH also mentioned that it could actually realistically be 10 times higher than what's recently reported in Alberta with the changes in reporting that we're experiencing. The province has also commenced wastewater testing for COVID that provides an indication of active cases. This is being done by the University of Alberta and the University of Calgary. This data provides trending information and appears to be consistent with what's shown with provincial positive COVID tests, that cases are increasing. This wastewater data will not identify where and how COVID is spreading. The provincial positivity rate for COVID tests has also been increasing, and the current 7-day average is 38.38%. While active cases have increased, hospitalization and ICU rates have not increased to the same proportion. Hospitalization and ICU numbers have been identified as late indicators of what's occurring with COVID. The CMOH has indicated based on other jurisdictions' experience in vaccinations rates, the effects of Omicron on individuals is expected to be less. She has also indicated that we need to look at Omicron at a population level, not at an individual level, for effects on the healthcare system. The challenge, she noted, is that the increased transmissibility of COVID can have a significant impact and overwhelm the system, even at lower rates of significant effects. We can look to see what other provinces are experiencing, as they are 2 to 3 weeks ahead of us in experience with Omicron. Hospitalizations in Ontario, Quebec, and in New Brunswick continue to increase and are at near or record levels with COVID. The province, region, and St. Albert are experiencing increased active case counts, which are higher than what has previously been experienced throughout the pandemic. In St. Albert, currently reported are 1,142 active cases. There's 4,619 recovered individuals and 54 deaths, for a total of 15 cases. Provincial data provided on January 9th had the following case counts. Alberta was at 57,332 active cases. The previous high in a previous wave was 25,917. The Edmonton zone reported was 20,749 active cases. The previous high in a wave prior was 10,194. St. Albert, as we talked about previously, is 1142 active cases. The previous high in another wave was 391. And this is all with restricted PCR testing in place. The Zone Medical Officer of Health, who you'll meet later on today, and Alberta Health Services EOC staff regularly meet with municipalities to discuss trends, comparison, and assist with some of the guidance on COVID. Looking at the same data and putting it in a per 100,000 cases per 100,000 gives an indication of what's occurring in St. Albert compared to other municipalities. As the data really isn't complete at this point, what it does is it indicates we're trending in the same direction as other municipalities. Our comparators are experiencing increasing numbers of staff illnesses due to COVID, and are planning for the effects of COVID and reviewing their contingencies based on health's advice. Health continues to provide advice that vaccination is a key factor in reducing severe outcomes to COVID. St. Albert continues to be a provincial leader in vaccination rates. The provincial vaccination rate for all ages is 79.7% for a single dose and 73.2% for 2 doses. And in the 12 plus population, provincially it's 89.6% for single dose and 85.5% for 2 doses. Also, the province has announced that in terms of booster doses, the province has passed the 1 million dose mark for those boosters. The St. Albert is above 70% vaccinated in both those 5+ and 12+ categories for first doses, as you can see, and greater than 90% in second dose vaccination for 12+. Health continues to emphasize that hospitalization and ICU rates for vaccinated individuals is lower than unvaccinated individuals. Yesterday, Monday, January 10th, the Emergency Operations Center was activated for the Omicron wave. This activation occurred due to the wide-scale nature of COVID, rapid growth witnessed, the city's experience that Ryan Stovall will discuss, and some of the uncertainty of the effects that will be seen with Omicron. The EOC has been activated to a level 1 status, which really supports situational monitoring and contingency planning. The activation focuses on safety of our residents and staff and allows for centralized communication, handling, decision-making, and planning. And it also enables the city to have a coordinated review of staff and public safety elements, such as staff masking recommendations and responding to changes announced by the CMOH. I will now pass the presentation over to Ryan so that he can discuss human resource impacts that the city is experiencing.
Awesome. Thanks, Percy. Good morning, Mayor and Council. I'm Ryan Stovall. I'm the Director of HR, Safety and Environment. And I'll do a brief recap of our current human resources impacts. From December 22nd to January 11th, actually, this is updated this morning, we've seen 72 employees with COVID positive. This is what we know. This is the one where a test result is identified. For context, that number exceeds, in less than a 3-week period, that number exceeds what we've seen throughout the entire rest of the pandemic. Of that 72 employees, 20 are active cases. 16 of those active cases are externally facing, so emergency services, recreation, public works. The other 52 of that 72 are beyond the isolation timelines. So they would have met their 5-day isolation and either symptoms remain or they've recovered and have returned to work either remotely or on site. All our cases are investigated. So once we know about something, we'll investigate and make sure there's no workplace outbreak or transmission, which there haven't been. And majority of those employees able to work remotely while ill or recovering. So we've had the holiday closure and about half of that 72 employees have been able to work remotely. So even while symptomatic or COVID positive, they've been working remotely through that as long as their illness isn't so severe that it precluded them from working. One of the impacts that we're hoping it doesn't become a major impact, but we're planning for nonetheless, is schools returned yesterday, and we do not know the impact on the education system yet, if they'll be able to absorb this or if there'll be a movement to online learning or if daycares are somehow impacted. Our approach and plan for this is to be flexible for those able to work remotely to balance family obligations and be ready with leave obligations or leave provisions for those unable to work remotely, but having to meet family care responsibilities. We also have no social activities or team lunches occurring, trying to minimize risk. Any recruitment or onboarding is virtual where feasible. Some positions like a public works operator would need to be onboarded on site. And employees have been advised to not engage in non-essential out-of-country travel per federal advisements. One other item I wanted to mention is that the city's employee vaccination rate is over 98%. Our employees have done really everything they can. Those that aren't vaccinated are rapid testing. And from my perspective, they're following all health and safety guidelines and recommendations we've put in place. So my kudos to our employees. Next slide, Percy. Oh, thank you. One thing that we are planning for, again, hoping that we don't have to implement, is some planning for redeployment of employees. So if we want to maintain certain services and the impact is quite large from this wave, we could consider redeployment to maintain some services by suspending other services or slowing other services. It'd be focused on permanent employees, so permanent services that we'd look at. I want to acknowledge this would be a fairly significant impact, because we believe the disruption could be for a short period, and not all employees have all the services or skills, that they would need to be redeployed. So it'd be impossible to redeploy myself to be a lifeguard, for example. There's certain limitations on redeployment, but we would look at that as a last piece effort to try and maintain services that we plan to maintain. And that's pretty much all that's all I have here, Percy. So I'll turn it over to yourself.
There we go. Now I'm muted, hopefully. What we did, we began discussions on planning for the pandemic early in January 2020, prior to some of the waves, and it was based on the information that was coming out of Asia at that time. The city departments commenced developing the business continuity plans to address potential staffing impacts of 35% at that time. Some of what Ryan has presented as impacts for human resources is incorporated into that planning for workforce disruptions. Currently, it's been reviewed by departments and refreshed, confirming the prioritization of services, staffing requirements, understanding some of the resources and dependencies, both internal and external, which can be things like suppliers, internally IT support, which is required to maintain services. Alternatives for impacts are reviewed with contingencies associated for each. The province has also provided some advice or guidance to municipalities in the provincial pandemic plan on what critical services are, and identifies that critical services may vary by community. They include, but may not be limited to, police, fire, public works, such as water and garbage disposal, utilities, public transportation, and or various social supports. What we've done is we've brought a number of what we've identified as critical service individuals from critical services to take some of your questions, and also some from front-facing services that would be able to answer specific questions to their area. With us is Danielle Pudlubney from Recreation, Elizabeth Wilkie from Community Services, Everett Cook from Emergency Services, Jay Mason from Public Operations. Additionally, we have Ryan Komaniak from RCMP and Paul Pearson from Strategic Services. So we'd be happy to take your questions at this time. And I'm going to stop screen sharing here.
I see Mike's hand is up first. So why don't you start us off, Mike?
Sure. Thanks, Percy, for the presentation, and Ryan as well. Just for clarification for me, level 1 EOC activation, is that the starting level and it works up to some other higher levels, or is it the other way around?
We have a pre-EOC level. Level 1 is the lowest level. Level 4 is the highest level, and it really the level 1 is truly about coordination and information, making sure we maintain good understanding of what's occurring at the current time. So there's a little bit more capacity to do stuff, but it is a very limited capacity. It's only kind of a weekday activation and that.
Okay, great. And do we, St. Albert, have any stockpile or reserve or quick access to PCR tests if we were to see an outbreak in our staff that we could deploy to kind of contain or at least get some statistics of our own staff and help them? Because I see PCR tests as a big problem getting access to.
At this current time, we don't have a supply. We've looked into access and getting that access of supplies. Right now, the supply chain on those PCR tests is very challenging, and the information we have on suppliers is later this month. Our availability would be.
Okay. Yeah.
What about the rapid? Sorry, Mike. What about the rapid, like the home tests, Percy?
I mean that's what I meant. The rapid home tests. Sorry, I apologize.
Okay.
Go on, Mike.
And sorry, last question, I guess, really is on. We have a high concentration of seniors' homes in St. Albert. Have we seen any increase specifically in that area and impact to our emergency staff, the ambulance dispatch, emergency services needing to respond to those? Has that put stress on the system yet?
Well, you can see there were articles in the news about in the Edmonton zone about ambulance challenges, specifically to St. Albert and that sort of thing. The province provides updates on their website about outbreaks in community, and that's in that piece, but they really don't provide a great deal about public information, just in terms of protection of confidentiality and in health information. So this could be a question you could ask Dr. Sikora a little later on when see if he has that information available for us. Okay.
And last question, I'm not sure if it's Ryan or on the fire side, but I saw in the paper today that Edmonton reporting 4.5% of their firefighters are currently off sick. Or are we trending in that direction as well? And can we manage with that? I mean, Edmonton's got a much larger base to kind of backfill from, but or cover shifts from. Is that something that's a challenge for us right now?
Maybe take that one. So far so good here at the RCMP detachment. We've had a few isolated cases, but it's more on the municipal employee side. So under Ryan Stovall. So that being said, we're definitely increasing our efforts to practice the recommendations by Alberta Health. So we're good so far, but that being said, we may be impacted here in the coming days.
And if I may just add comment with regards to the fire services, we're actually in a very fortunate position as we are somewhat, call it overstaffed right now as we move towards opening up Station 4 in the future. That has allowed us a buffer of staff to absorb any of the cases that we have occurred or that have occurred within the fire services since this latest outbreak. So In summary, to your point, we're in a very good position, and we have not experienced the significant impact that our neighbors in Edmonton have from Omicron.
Oh, that's really good news, Everett. Thanks. Thank you.
It's a good advantage of overstaffing for Fire Hall 4. That's awesome. Shelley, any questions?
Hi, yeah, I do have a question of the 1,100 cases in St. Albert. Is there any data on the age of those cases, individuals?
It's put out as kind of aggregate data, and that we typically get a little bit of information on what those cases look like at a zone medical officer of health meeting. That typically happens later in the day today. So I wouldn't have a little bit of that kind of detail of granularity of information at this point in time.
Okay, could we have that relayed to us once you do have it, if possible, please? And another question I have, like Saskatchewan is doing far better than many of the provinces. And I mean, their restrictions have been quite different. Is there anything that Alberta is learning from Saskatchewan, or why are they doing so much better?
Might be a question for Alberta Health Services, not our staff. Yeah. So save that one for Dr. Sikora.
Okay. Thanks.
Yeah. How about anyone else on council that's not on the committee? Any questions? Ryan, I had a quick question. You know, when we're looking at the percentage of staff that are out sick, are you also in touch with those that we contract to? I'm thinking more transit, and then the green bins and the blue bags are all contracted. All the contractors that are servicing St. Albert, are you in touch with them for their staffing issues?
I haven't been looking at employment impacts is kind of my focus. I see Jay maybe on there. He may have a better update on the contracted services on one side. And if he has something to pop in on, I'll pass it to him.
Yeah, especially in transit, Jay, any idea?
So right now our transit group is doing okay as far as the contractor goes. So our service delivery, they're not having impacts on their side as of yet. We do have backups in place that if we do see a significant run, they don't have additional capacity if they do have a run to be able to draw from other places. All their drivers are associated with all the routes right now in our zone as well as in Edmonton, et cetera. So, but we do have some contingency plans in place if they do have a run to at least keep a general service going.
Does that plan put you behind a wheel, Jay?
No, I think that caused more safety issues than COVID.
I think Councillor Broadhead used to drive a bus. He might be able to help out.
Yeah, but we do have actually one of our members on the management staff that is trained to drive a bus that if it got to, we would be able to put him in. So
that's funny. Okay, and Ryan, how are we doing for vaccine rates with the staff?
One of the items I commented on is that we've basically hit the limits of what we can get. We're over 98%, and those not vaccinated are rapid testing to attend on site at their expense. So we've pretty much hit the limits of what we can get in that program.
As long as you're comfortable with it, then we're comfortable. So that's good. Mike, I saw your hand jump up.
Yeah, this one might be for Danielle. It's I know in the past we've seen residents expressing concern when they go to our recreation facilities, and maybe it's expressing confusion as to what allows them to go into an event or not, and that's pool services or hockey games or whatever, drop in volleyball. Have we seen any challenges recently? And I know people worked hard to clean up the communication with our frontline staff to avoid that. But I'm really, my question is, I want to make sure we're doing as much as we can to give our frontline staff all the information they need so that they're not put in a tough frontline position with residents.
Thanks, Councillor Killick. So we have been working to continue to improve our communication and just continue to communicate to the public all the expectations when visiting our facilities. I would say for the most part, most people attending our facilities are used to our processes. We have, REP checks at the facility entrances, and those have been going fairly well. The odd, I'd say, interaction, but for the most part, most public members are very happy and aware of the processes, and really that's happening lots through the region as well. So I think it's become a more base level of expectation, and we just continue to refine our communication, improve our training with our staff as we encounter certain scenarios, and I think we've come to a pretty good spot with that.
And if we do get into a situation frontline, is there a quick number to call for help kind of thing? Process outlined so that the frontline staff aren't kind of left individually. I'm thinking of a young frontline staff worker at service that's dealing with a resident that might be argumentative. Is there a quick help number that can quickly get that person support that they need to answer any questions?
Absolutely. So our staff have safety protocols in doing all of those tasks that they're doing on a daily basis at our facilities. And they would have lines of communication to our municipal enforcement services, who also do routine checks through our facilities, just stop-bys. We also have management and supervisor presence at our facilities and check-ins, as well as we tie into public operations in our operation of all of our facilities for consistency's sake. So there is definitely safety protocols for our staff to use should they run into a challenging situation with a patron.
Yeah, great. Okay, thanks.
It's too bad we actually have to plan for that, but I'm glad you guys do.
Yeah.
Councillor McKay, any questions? You're good?
No, I have my hand up for a while here.
Oh, sorry, go ahead.
Yeah, no problem. I think some of that, my questions have been covered in the last response. However, I guess with Go Auto, does Go Auto exceed that 1,000 limit capacity and requires program 50% capacity, no food and beverages?
You are correct, Councillor McKay. Go Auto actually has a seating capacity of around 2,000, so it is under the restriction right now of half capacity and no food and service, no food services in that facility.
So just following up, I guess, on Councillor Killick's concerns. We had minor hockey week now, and then we've got John Reed starting on Thursday. I imagine there's lots of signage. I haven't made it down there yet, so.
Correct. There is signage at all of our facilities indicating any parameters or any public provincial guidance expectations are noted at all of our facilities. We do have two facilities that have that limitation, and that is McGinley Arena and Go Auto. So both are signed accordingly. We also work with the tournament organizers and our sport partners in communicating that message as well, so that the public has better understanding of what the expectations are when in our facilities.
So in relation to the food providers on site at service, particularly, I guess, at service, I guess, let's focus on that. So they're still providing food services, but whoever is patrons, I guess is the word I'm looking for, there's just site-specific areas they can actually eat or drink.
Correct. So when in our facilities, there is food service at some locations. There is certain spaces that they can consume their food and beverage. There are certain limitations in terms of where they cannot take their food and beverage. And those are those facilities that seat more than 500 people. So those are kind of the limitations. And we've signed those components of our facilities as such. And we do routine walkthroughs as well. Our staff will do walkthroughs of spaces as well and remind people of masking, remind them of any of our rules in the facilities at this time.
All right, thanks. I imagine it's getting quite busy in service. I'm sure from just my past involvement with those two events. So I'm sure there's a lot of reminding going on.
Yeah, it's getting busy, but certainly our event organizers and our sport partners have also scaled back where possible. They stream services whenever possible. They're reducing the need for people to come to the facility as much and giving people opportunities to watch from home if they prefer. So we are seeing that there's a bit of give and take there as well. With kids out of school last week, it was busier in our facilities for sure. So we're seeing some ebbs and flows, absolutely.
Thank you.
Any extra security that has been hired for some of these facilities? I don't know if that's for you, Ryan, or Danielle, or Diane.
I can, it doesn't matter. I can pop in. Yeah. Diane, you want to go ahead?
Go ahead.
Okay, so at our facilities, we actually have extra staff on now doing the REP program at our facilities, which was previously managed by security, but it's now being managed internally through staff. So we don't have, we may have our routine security detail that goes through the facilities, or our facility supervising associates that'll walk through our facilities, but we don't have extra security brought on for purposes of managing COVID at this time.
Okay. Any more, Ken? All right, I think the last question I have maybe is to you, Carrie. Money. How are we doing? I mean, we've been giving, council's been giving chunks of money. We gave a bunch in the spring of 20, and then, so I'm just, this is an ongoing, or to answer two things, reduction in revenue and increase in expenses for all this stuff. So how are we doing, and do you need anything else from council?
Yeah, well, thanks for the question. And we're just in the process of rectifying our accounts right now. And so we may have to come to council for an additional ask going into 2022. Where we're sitting is that we may have some leftover or whatever unspent funds that we'll be able to apply towards some of the things that we had put towards COVID in 2021. But we should be able to, we'll probably have some information to bring forward, I would say by late February. And that's when we'll know if we'll need to bring forward, if we'll need to ask or not for additional funding. So probably come forward and ask for, if we have to ask for funding, it'll probably be in that $500,000 to $1 million range.
Did we set aside some of the municipal operating sustainability, the most money?
Yeah.
We set some of that aside, did we not, for this purpose?
Yeah, so I'll let Diane speak to the actual accounts. We've been taking it out of sustainability, but the sustainability fund has been getting topped up by that. So I'll let Diane McMorty speak to the account reconciliation.
Great. So for the most funding, what we did is we were able to actually claim full use of that money in the first year that we got it. So the advantage to that was that we sort of were able to close the books with the province because we had enough lost revenues alone in 2020 to cover off the amount of money they gave. So the fact that we didn't spend it all and put it in the stabilization fund, it's now kind of, I don't want to say free money, but we're not restricted in terms of what we can use it for. So of course we've used it the last couple of years, or money, and I'm just going to refer to it as money in the stabilization fund now. It's no longer specifically most funding. We've used it, of course, to help reduce our tax rate increases. Over the last couple of years, we've been using that as an offset. We're pretty comfortable, although like Carrie had mentioned, closer to the end of February as we're closing off our year-end books, that because I believe we have $1 million, I think, approved by council related to COVID. And while we spent that money in 2021 in terms of COVID expenses, we've very likely had enough operational savings throughout the year to cover that. So we likely won't have to pull that money from the stabilization reserve at the end of this year. So we may look for council to just sort of leave that approval sort of on the books, so that should we require it for 2022, it'll be there. But we'll have more information towards the end of February as we close off our year-end books.
Okay. All right. Ken, you had a question for either maybe for Diane or?
No, actually, I'm going to draw Elizabeth into this, if it's all right.
Yeah.
I'm just curious in relation to our vulnerable populations and our social agencies, if we've heard anything around the impacts of not only Omicron, but also our sustained cold snap. How are we faring from that perspective?
I will actually pass this over to Connie because I was off for the last week. So it's Connie that's been having all of the conversations with the organizations post holidays.
I tried, Elizabeth.
Well,
thank you, Councillor McKay, for the question. So in terms of the vulnerable population, we did have our cold weather protocol in place. We did supply grocery cards and commuter bus passes to the RCMP and bylaw over Christmas. We had a hotel available with funding through the Community Village and Food Bank if we had any vulnerable residents that required it. We are aware of, I believe, only one vulnerable resident that was supported through the RCMP, and I believe it was with grocery cards. So we fared pretty well. What we know to be true in St. Albert with our vulnerable population is because we don't have shelters and a lot of housing available, our vulnerable population often finds other housing in the cold months. So we fared well, but we were prepared. Our social agencies are faring well so far. The Community Village and Food Bank, specifically, I was in contact to ensure that they're able to continue to work. As we know, with shutdowns, more of our residents become maybe more reliant on the Community Village and Food Bank. So they have contingency plans in place. They're ensuring they're not bringing in any more volunteers. They've limited the number of days that they're sorting. So they do have plans in place to continue to operate. And we will stay on top of that. And the other agencies continue to provide virtual services and are faring so far so good.
Thanks. I appreciate that. That's actually good news overall. I guess either Carrie or
before Connie goes away, I have a birdie on my shoulder saying it's a special day for Connie. So I won't embarrass you, but you have a fantastic special day, Connie.
Thank you.
Go ahead, Ken.
Yes, ditto, Connie. All the best. I guess what about how are we impacted around Arden and some of the other events that are going on? Are we seeing any changes to our program delivery? Aha, I did get you, Elizabeth.
I will take this one because the Arden Theatre operations is impacted through cross-country touring schedules, the closures in Ontario and Quebec, and the recommendations around travel interprovincially and across the border is meaning that we have our scheduled artists are revisiting their tour dates. So we are currently in the process of rescheduling about 4 of our planned artists to later in the spring. And we anticipate we will see some more rescheduling happening.
Will that carry on? I know we're meeting with the Children's Festival later on today. Will they be impacted by that as well?
We are still planning for a Children's Festival to happen as a combination between virtual and in-person delivery. Much of our in-person delivery is being planned around the rep sort of operations that already exist within the Arden Theatre and outdoor spaces. So our planning is based on distancing, outdoors, ventilation, all of the processes and practices that we know increase safety and viability of the programming. So at this point, we are still planning for festival.
Great, that's good news. Let's hope.
Yeah. One-man Star Wars show, Elizabeth?
Sometime soon. Sometime.
That one. All right, any more questions? And I do have the participants panel up. Sorry about that, Ken. I can see your hand now. It goes up. Anyone else? Okay, I think we're good. What time is it? It's 9:45, 9:46. Dr. Sikora is expected to join us at 10. So why don't we just take a quick 15-minute health break and have our cameras back on at 10 o'clock when he joins us. Okay. Hi all, I'm here. I'm just waiting for Dr. Sikora to join us. I don't see him online yet.
No, he hasn't joined us yet, Mayor.
Okay, we'll wait. Is there any questions we want to specifically ask him while we're waiting? I know Shelley, you were saving one for sure. In that, where's that puppy?
Oh, hiding. Having a nap. My only question would be access to rapid tests for people who have day jobs.
Okay.
So.
Percy, do you meet with him very frequently?
Right now, we're meeting on a weekly basis, and so that's kind of the schedule we have with him. And if we have specific questions, where he's more than accessible on that front.
That's good. And so quite often yeah, I see him joining us too. Hello, Dr. Sikora. I was just asking Percy. Percy, every once in a while you send us, I don't know if it's a weekly update on the status of COVID. And in your update, it does include St. Albert specific numbers for hospitalization and ICU. Are you getting those from Alberta Health Services?
From those meetings? Yes.
On a weekly basis.
Yeah.
Yeah, because it's not available for the general public to see on their website. So okay. Right. Thank you for joining us, Dr. Sikora. Good to have you back. Good. We have a couple of new members of our city council since the last time you joined us. So I will actually, you met everyone else, but I'll let Mike go ahead and introduce yourself.
Yeah, good morning, Dr. Sikora. Thanks for joining us. I'm Mike Killick, new counselor, and but not new to all of the past 2 years of COVID related scenarios. So look forward to hearing your update, and thanks for joining us this morning.
And Shelley?
Good morning, Dr. Sikora. Shelley Bermansky here, new to City Council as well. So look forward to your update. Thank you.
Awesome. So process-wise, do you have a bit of an update, Dr. Sikora, or you just want to take it straight to questions? We're hoping you have an update.
First, Percy has done a bit of a PowerPoint, if I remember right, correct?
Yeah, he did, yeah.
Okay, and I think the only major things to add at this point in time are that we do have expansion of a particular variant of concern. So we have Omicron circulating in and around Alberta. It's very efficiently transmitted from person to person. So that's one concerning or extra concerning feature. So we see very, very widespread spread amongst our population across the Alberta, Edmonton area, as well as across Alberta and Canada. It's mirrored elsewhere around the world. So every other province is experiencing this to varying timeframes. I think Ontario might be a little bit ahead of us. So we're looking to Ontario to see where they're at to really predict and foreshadow where Alberta is going to be. The other concerning feature beyond it being transmitted and very effectively transmitted from person to person is that it does evade immunity, so that the vaccine sets that we have been able to provide to our Alberta population are effective. Just to have the most amount of protection, you need that third dose. So booster dose, that third dose is exceptionally effective at preventing severe and invasive disease or hospitalization. So we're encouraging everyone to get that third dose as soon as you can. Having 2 doses of an mRNA-based product is very good. I think our data is showing about 30 to 50% protection. If you get that third dose, that really increases your personal protection up to 70% or more. So, because of that widespread communication within the population itself, we're also keeping very close track of the severity that it causes. Now we're learning from other jurisdictions, so this is science being done in real time. We are seeing that it is less severe than Delta or the other variants. That being said, decreased severity is balanced with overall total increased case numbers. We have very high concern for our healthcare system capacity to be able to manage the case numbers that are being presented. So we have seen in the last several days a large increase in presentations, both to emergency department and to those requiring hospitalization and critical care overall. Highlights and stresses the needs for all of us to be doing a number of key things. The hand hygiene, the staying home when you're sick, the safe for work, safe for play, safe for learning screening that we have all done on a daily basis for the past 2 years. We've had and seen upgraded recommendations from our Health Canada partners around the use of face masks and masks to help protect yourself, but also protect others. Masking is one tool in that toolkit, and it's to be used as a complement and an addition to those other things that all of us do to help keep others safe. So masking has been to this point use of a 3-layer mask, one of which has a very tight fabric layer. Health Canada, I believe, has revised to really entail get the highest quality mask you can, including an N95 respirator that's seal tested, or is something that can help prevent transmission from you to other people, but also protect you from transmission from other individuals as well. We still have current recommendations and rules from Alberta Health colleagues indicating gathering size restrictions, as well as the restriction exemption program that's present in many of our facilities and locations in and around Alberta. We've seen a return to school this week and slight revisions in terms of how parents and students and teachers and healthcare workers are being supported. So we have a rapid testing process that's in place that is rapidly evolving. So rapid test kits are on their way, just not quite yet. Still a little bit of work that's being done in the background to help ensure that that's being done in a consistent manner. And we've also seen some revision and nuance in terms of our isolation requirements. So 5 days isolation if you are fully protected from an immunization perspective, as in 2 weeks past your second dose or completion of that first primary series, and remain to be asymptomatic. If you are not fully immunized or not immunized, you are to isolate for 10 days. Or until symptoms resolve, whichever is longer. So some minor revisions in terms of what isolation requirements are, and that's really to help stem and reduce the possibilities and potential of transmission from you as an individual who's COVID positive to other individuals. So a lot of changes in the past week and a half, and perhaps Percy, if you're okay, us moving on to questions.
We can do that, sure. All right, I know there are some questions that came up earlier in our emergency management meeting that Percy was unable to answer because it would be better directed towards Alberta Health. So Shelley, do you want to start?
Oh, sure. I'm on Alberta Health Services. I'm not the
Alberta Health Services, that's right. Actually, Dr. Sikora, that is a really good point. And for the new members of our council, can you maybe explain the difference between the policy side of Alberta Health Ministry and then what you do with the more operational in Alberta Health Services? Maybe that would be helpful just to make sure the questions are directed.
Sure, certainly. Within Alberta, we have two major entities. We have Alberta Health, who is the funder and policymaker for all things health related, and then we have our provincial health authority, Alberta Health Services, who is the operational arm and really implementer of those policy actions by Alberta Health. So AHS is the service delivery organization. We're the workers, we do all the stuff. Alberta Health sets the policy and sets the funding, the funding directions. Decisions around health policy around testing, around isolation, around chief medical officer health orders are done at the Alberta Health level. So Premier and Cabinet are the decision maker sets in that, informed and supported by the good folks in the Ministry of Health, including our Chief Medical Officer of Health. Within the Alberta Health Services environment, myself and our zone team, Dr. Dave Zegan, Carol Anderson, and our medical officers of health from across the province help support our municipalities in helping implement those policy options and those policy activities. So we're here to help support our decision makers at the municipal level. And likewise at the municipal level, you also have your support from municipal affairs. So many different pieces of the puzzle that do fit together. Over the past year, 2 years, Percy, I think we've been supporting for decades, we've been supporting our municipalities as the health authority. More specifically, over the past 2 years of the pandemic, we've been meeting several times per month, sometimes as frequently as several times per week with our municipal partners, emergency management officers and administration, to be able to help support in terms of the information needs that our municipalities have. So hopefully that helps provide a little bit of context.
No, it's a good reminder, because I just want to make sure that the questions you're getting are there more restrictions coming, or why those kind of things are policy driven and not operational. So unless you have some insight that we don't know about, we'll try to avoid those questions. So go ahead, Shelley.
Okay, I'm not sure with the layers of government if this question is directed in the right position or not, but I was just curious if there was any research showing why Saskatchewan's doing so much better when they had far lesser restrictions than Alberta. We're at 57,000, they're at 7,000 cases. And, if that's looked into. And the other thing I had is, I don't know if you probably don't have anything to do with this, but the Alberta Healthcare update, or whoever provides the update of hospitalizations, why is it so outdated, still showing September 1st information? So if you can answer either of those, that would be great.
Our hospitalization set, both for inpatient as well as critical care use, are updated on a near real-time basis. So we have, and I'm reflecting what I see on the alberta.ca, so Alberta Health maintains that information as a source of truth, and our municipal partners and Alberta Health Services have both been going to that site to be able to get that real-time information. It is updated frequently.
The graph does show September to December, the graph that they put forward, the one that Mr. Janke presented as well. It just never changes. It's September to December.
That was hospitalizations?
Yes.
Percy, I'm not sure which graph had been shown.
That was the chart that was on Twitter, just the percentage of ICU and hospitalizations that were associated with single dose unvaccinated, vaccinated, and that gets updated on we see that updated kind of periodically, as opposed to the case count on that, what you're talking about, I think, in the dashboard.
Yeah, so the dashboard does show the hospitalizations, both in inpatient as well as critical care. I believe what Mr. Janke had indicated, or at least had shown, was an interpretation, or at least an overlay. So often what Alberta Health will do is, here are the raw numbers, here's the secondary data set when you overlay a particular variable or a particular factor. So if there was an interpretation of what the hospitalization based on 1 dose, 2 dose incomplete, 2 dose complete, 3rd dose, then that commonly does take a little bit of extra time, and those do actually have some delay. So in terms of your first question regarding the Saskatchewan, so I don't have Saskatchewan specific numbers, but what we normally will see, and what we've seen across Alberta, is that testing volumes right now are exceptionally high, with refinement from our Chief Medical Officer of Health yesterday indicating that individuals should be accessing the PCR-based, lab-based testing only if you're a healthcare worker or if it's going to make a difference or impact a treatment decision that might be necessary. So that's, I think the lab strain and the testing strain is something that's been felt across all of Canada. So many of the provinces are experiencing that as well. Now, I think all provinces are feeling the stress of Omicron itself, both from a total case count perspective, but also from a healthcare system perspective. In the AHS realm, I know we are ramping up and preparing for large influxes of cases, both from our inpatient as well as our critical care usage perspective. And flatten the curve is something that we all hope to be able to do. And flattening that curve does take a number of different steps and has a number of different components to it. One is the hand washing, staying home when you're sick, reducing your outside interactions, gathering sizes, use of a face mask, and of course, immunization is that cornerstone to help protect yourself and others.
Any more questions, Councillor Romanski?
No, thank you.
Sure. Okay, Councillor Jolly.
Thank you. I've got 3 questions. First one is regarding the booster dose for 12 to 17-year-olds. So we've heard that 3rd dose is really important for protection. And many of those kids are post 6-month mark. So I don't know if you've heard anything about when that might be available.
Of course, the immunization policy decisions are run by our Alberta Health colleagues. I thought, I'm going to have to go back to, I thought they had made an announcement about that relatively recently. Sorry, I'm just trying to find it real quick here.
3, a hard question.
So if 18 and older can get a 3rd dose 5 months after their 2nd dose. And I believe they're probably still considering the 12 to 17 at this point in time.
Okay.
And when that'll come, I'm not sure, but I know they have a very lively and robust immunization committee that reviews all the evidence and helps set the policies in a consistent manner to help protect those that are in those age groups.
Great, thank you. My next question is about the access. So in St. Albert, we've got access to rapid tests through our public health unit, which is great for those of us kind of with flexible jobs who can show up during the day to pick up tests. So is there any plan to make those available to people who have day jobs, I guess?
There is.
Like through a pharmacy?
Or wherever, okay. At the library.
There is quite robust work still underway around the rapid testing process. It's in evolution. This has been a very busy week, so I can take that feedback back to the testing group to indicate that there's a want to explore other testing modalities, or at least other testing locations. And Councillor Jolly, you're specifically about the rapid test kits themselves.
Thank you.
You've got kids in school, Natalie. They should get one.
Well, yeah, I've one who would be eligible for a 3rd dose. The other 2 just got their 2nd last week. So no,
but I think, are they supposed to bring home some rapid test kits?
Oh yes, they are. No, yeah, for me it's fine. I have access. I've got rapid tests, but I don't work 9 to 5. So
I believe that yes, the schools are to be getting rapid test kits for their kids. Just that's still an evolution, and I think one of the shared experiences across the province as of today and likely tomorrow is that the access to rapid test kits isn't great, but it should be improving in the upcoming days.
Okay, thank you. And then my last question is a little bit tougher one. So you commented on the fit tested respirators are a great choice if you have access to that. The 3-layer masks are kind of second choice. Cloth masks, I assume, are kind of one under that. Is that
so? In terms of the hierarchy of face coverings, we have, and there is a hierarchy of face coverings.
Yeah, like I've got a whole drawer full of cloth face masks that I feel like I might be burning, but.
In the healthcare setting, we would, if we're caring for COVID positive individuals, or if we're doing aerosol generating procedures like intubation or suction of the airway, we would choose what's called a fit tested respirator, an N95 mask. What fit tested means is it makes a really good seal around the face. When these are fit tested, they're fit tested in a lab environment. As a healthcare worker, we get a sticker on the back of our RD tag saying this is the name and model number of respirator that you should be using if you are doing this procedure. Our healthcare workers do a point of care risk assessment to say, what am I going to be doing with this patient? Is this patient COVID positive? Should I be protecting myself at minimum with the hand hygiene, gloves, gown, eye protection, and then if I'm going to be doing something that puts me at increased risk, I should be probably using an N95 respirator, a fit-tested respirator. That's at the top of the hierarchy. The next step down from that is the seal-checked respirator, and that I think in the general sense that would be a KN95, and that's ones that when you do a seal check, you put your my voice might get a little bit garbled here. You put your hands around the respirator, you breathe in, you see if it makes a seal, you breathe out, you see if it puffs out. That's what a seal check is. That's something that's slightly down from the fit tested. It's still very good. We're recommending that those be used, the seal checked respirator be used in the community environments. A surgical mask is what we have been using also in many healthcare settings and is still a very good choice. It's better or often better than a 3-layer, one of which is a tight layer cloth face covering. The next step down would be one of those 3-layer masks. And then you have the simple 2-layer that are sort of at the bottom end. Okay. When we look at these in a laboratory environment, a fit tested respirator is predictable. We know it's going to filter out and from out and in perspective, a certain percentage of particles. The seal checked is going to be not quite as good, but still very good. A surgical mask, again, is going to be not quite as good, but still very good. And then it goes down from there. We have been indicating that over the course of the pandemic, if you are in those high risk environments where you are likely to encounter a COVID positive patient, COVID positive individual, that you choose the highest level of protection that's reasonable. In a healthcare environment, that also depends on what you're going to be doing with that person. If you're going to be in very close proximity, then you would choose an N95 fit tested respirator. If you're out in the general environment, we've seen just due to the profound spread of Omicron and the ease at which it does spread, we've seen that revision and really refinement from our Health Canada partners that choose the highest level of protection that you can, or at least have access to.
Okay.
Hopefully that helps.
Yeah, that's really good. And the plastic face shields, are they offering any protection?
Plastic face shields do nothing.
Okay.
The little chin thingies don't do anything. Okay. The big plastic bolt around your head does nothing.
Okay. Okay.
And
Thank you.
They are not recommended.
Okay. Thank you, Mayor. That's all I have.
That's good questions, because it's in the news right now that kids at school are going to be getting medical grade masks, and I think there's confusion of what a medical grade mask is. So yeah. that was awesome. Yeah. Councillor Brockhead.
Thank you, Madam Mayor. Thank you for your briefing today, Dr. Sikora. My question to you is, in light of information that's coming into the science in other jurisdictions around the world, is the up of Omicron just followed by a similar down spike after the wave? I guess the question is, are we seeing this Omicron wave as being short in duration, even though it's very high in transmission? Are you seeing that in places like Israel or South Africa or Britain, who are ahead of us in this wave?
Councillor Broadhead, that's a wonderful question. Every one of our populations around the world are very unique in both their age, their protection, their previous experience with COVID-19. So in many ways, each of those will have a very distinct and unique curve. South Africa, for instance, has a younger population. But they also had a very much worse experience with COVID in their previous waves. We've seen a large spike or a large increase in the number of Omicron cases in Alberta over the past several weeks. That may follow a number of different paths. That may have a rapid spike down, or it may be a slower peak on the downflow or on the downslope. Ontario was probably a week or two ahead of us, so we're watching them very carefully. We're watching England very carefully. We're watching Denmark very carefully in terms of what their experiences are from a healthcare system perspective, but also from that population perspective. So I don't know what the back end of that wave is going to look like, or what the back end of that curve is going to look like. At this point in time, we have a great deal of concern around being able to reduce the height and maybe lengthening out a little bit, just so that we have that capacity in our healthcare infrastructure to be able to care for those individuals that do present to hospital. So if it's a little bit longer and a little bit less high, hey, that's ideal. I remember our phrasing from 2 years ago saying flatten the curve. We want to be able to help flatten this just a little bit, and all the things that we can do to help flatten that are getting immunized, get your hand washing, stay out of public environments, help stop yourself from getting infected, and such that we've been doing over the past 2 years together.
Okay, thank you. I appreciate that. Just a follow-up question then. Is Delta off the books now? Is Omicron totally wiped Delta off the books, or is Delta still a variant of concern?
Give me a second here. I drew a little chart. So we saw Delta very high. We saw Omicron very low. It did cross. Omicron is the predominant variant right now. We still see very small percentage of Delta. So yeah, it's almost all Omicron right now.
So Dr. Sikora, is every positive case then sent for variant classification?
It used to be. They had done some talk about changing that at the end of wave 4. I believe that they are still testing a subset, at least, of the positive cases that get sent to the prob lab for analysis, to be able to have an understanding of what is the predominant variant. So if they aren't testing all of them, they're at least testing the subset to be able to help better understand what is the predominant variant, as well as to help predict and monitor should new variants come along that we otherwise wouldn't know about.
Awesome. Good question. That was one of mine.
That's it for me, Madam Mayor, and unfortunately I have to drop off the call now completely. So
okay, we'll see you later, Wes. Thanks for joining us.
okay, bye. Thank you.
Councillor Killick.
Dr. Sikora, thanks for all the information so far. A couple of questions, operational, I think, in nature. In terms of our hospitalization capacity, we hear a lot of news across the country that, hospitals are at full or close to full. Where are we in the region, and what does that mean for our current capacity of patients? Are we shipping patients around the region? So kind of a two-part question there.
So from a hospital capacity perspective, we are still in a situation where we have the exceptional critical care spaces open. And those exceptional beds are have been in place for a number of months now, and of course helps support our Alberta and Edmonton area population over wave 4 and continue during this particular wave. Our inpatient capacity again is expanded beyond our normal capacity, and again, that's been in place for some time to be able to help respond to respiratory illness that's present in and around the area. So we are still strained in terms of capacity to be able to help support a population. The other concern that comes along with that is, well, a bed is an easy thing to build. It's not so easy to staff. With such profound transmission in the Alberta context, we have a great deal of concern around our staff needing to be on isolation should they be themselves a case of COVID. So we've seen a revision and a further description and refinement from Dr. Hinshaw yesterday about healthcare worker and critical service workers needing to be tested preferentially with PCR, at least COVID testing. We collectively, for all critical care and critical service workers, and there's a lot of critical service workers in both of our collective organizations that help keep everything running smoothly. We've done a great deal of effort to be able to help get them protected. So for the first 2 doses and now that 3rd dose to help protect overall. The science has refined an isolation period for those that have been fully immunized and don't have symptoms. So this for that very mild illness, well, 5 days is enough to be able to help limit spread, provided on days 6 through 10 you wear a mask if you're out in environments. So that there's been a great deal of refinement to be able to help protect that workforce, but that workforce is it's very tenuous. And well, everyone is stressed and strained right now in general in society, but very much so in our healthcare environment and our critical service environments as well.
Okay, the other question is mask related and may seem funny, but see people, and I'll say even myself, will reuse a mask for a week or whatever, because kind of, is there any guidelines of saying you should only use your and typically there's surgical masks, but is there any guidelines that say we should only be using those surgical masks for 1 day or 48 hours and then throw them away and get a new clean one? Because I haven't seen any communication on that, and I know my grandkids seem to have been wearing the same mask for 2 years, which is probably not advisable. So is there any communication around that and guidelines that we should be aware of?
Health Canada does have guidance on that. I'm going to see if I can put that into the chat box. I think I can do a chat box here.
Yep.
Yeah. I mean, maybe it's out there. It just hasn't ever been top of mind. And yet, as I said, I know lots of people, myself included, are probably not following the appropriate guidelines.
I think the structure is, and the link is there. There's a downloadable PDF as well. So it's important that when you put a mask on, you do hand hygiene, put your mask on, and when you take your mask off, you do hand hygiene, take your mask off, put it in a clean environment, clean paper or cloth bag if you plan to wear it again. Other things that are outlined are change your mask when it's dirty, damp, or damaged, or soiled, and then wash reusable non-medical hot soapy water, throw dirty, damp, or damaged disposable masks and use garbage. We use a mask recycling program. Frequency at which people soil their masks or get them damp Certainly in our cold outdoor weather, things probably get damp a little bit sooner than they normally would. I know I have a box of masks in my car, and sort of we burn through those at a pretty good rate, but still appropriate. But yes, the guidance on how to apply, how to don or doff a mask is present and out there in the public. This is also mirrored on Alberta.ca, but just like the Government of Canada one, because it's actually pretty good. Hopefully that helps a little bit.
Yeah, thank you.
It's hard, Mike, because we've been trained to reuse and reduce our waste. And so, we think we're doing a good thing by reusing our mask, but it's probably a good reminder.
Yeah, yeah.
So you have no more questions, Councillor Killick?
No, I'm glad for the answer on our hospital staff. We hear all these scenarios where people are just feeling absolutely burned out. And like you said, it's easy to build a bed, but very hard to get to 4 or 5 or 6 or 7 critical care people to support that one bed. And it may even be a higher number than that. So I think people kind of lose sight of the amount of staff that it takes to have somebody in hospital, and we should do everything we possibly can to avoid that.
It's also not just our hospital environments. Our long-term cares and our continuing care facilities have those are home environments for many, and our folks that support our residents in long-term care and continuing care do amazing work to help keep those residents safe. And again, they are doing their best to be able to help make those safe environments, and they're doing the necessary hand washing, use of PPE and hand hygiene, and masking and eye protection to be able to help stop outbreaks overall. But those are just as sensitive and critical environments. So it does run across the entire spectrum of care.
Yep. Thank you.
All right. Just a couple from me, Dr. Skora. When you talk about the severity of Omicron, is that overall? So is it less severe because we're vaccinated, or when you talk about the severity, is that just being determined on those that are unvaccinated?
So overall severity has been something that we're constantly monitoring and sort of watching very closely what the World Health Organization and Centers for Disease Control are indicating. So Omicron overall does have slightly lower, or it's seemingly that across populations it has less severity. And what we've also seen with those that have been immunized, have much milder disease. Still possible to transmit, so that isolation, if someone, even if immunized, has been identified as COVID positive, it's really important to have that isolation period. But those with the benefit of having a full immunization series typically do have much milder illness.
And so speaking to that, in your initial speaking notes, you talked about getting an mRNA booster. So for those people in the population that got the AstraZeneca, which was not mRNA, and then they got follow-up mRNA second dose and then booster dose, are they considered boosted, or do they need yet another third mRNA? Is the boosting only effective with the mRNA vaccinations? I guess I'm asking.
That's probably a really complex question, because there's a lot of variables in there.
Okay.
Now, I think individuals can chat with 811 or our Alberta Health Link to be able to identify what they could be eligible for and what's in their best interest overall. Now, what constitutes fully immunized is 2 doses or a complete series of a COVID-19 vaccine, which could be either Pfizer, Moderna, AstraZeneca, or the Janssen product. Janssen is a single dose product. So that single dose would be considered protected, or at least completed. What we've seen with protection from Omicron is that those with the benefit of an mRNA-based product are often most effectively protected after having that third dose overall. So that third dose is something that is important to help that individual have the full benefit of immunization or the full protection from immunization. Now, that third dose might be a third dose of Pfizer, if they had had the AstraZeneca's doses 1 and 2, just it ends up being quite individualistic.
Okay. I just know there's people out there that have a combination and they have 3 shots and they consider themselves boosted and they're not going to get another shot because they consider themselves boosted, and are they? So the best
policy-wise, they very well may be. From a individual health perspective, those that have had 3 doses of an mRNA-based product are often best protected from.
Okay. All right. So 811 is the best person or best place to get that information for an individual. Okay.
For an individual.
Yeah. All right. And I guess, I used to post quite frequently the active cases in St. Albert. I don't do it anymore because I don't find it a good indicator of the disease. And so I appreciate you giving Percy at least the St. Albert specific hospitalization and ICU numbers. I find them more valuable. So Percy, if you could keep sending them to council when you get them, that would be great. I'm not asking for them to be available on the website because it just gets confusing, but I appreciate it is available. I think it's time, honestly, to stop looking at the active numbers because it's an indicator of what's coming, but it's also a lot of people are panicking unnecessarily. And so those hospitalization numbers are key because that's a real truth of what's coming. So any other questions? Oh, I see 2 more hands up. Sorry. Councillor Bermansky and then Councillor Mackay.
Okay, I have a couple other questions.
Yeah, sure.
You had mentioned, sorry, Dr. Sikora, on the third dose, you're mentioning like a 70% coverage on the booster, but I mean, it was higher than that percentage mentioned on the second, vaccine dose prior. So now people are being told, well, now the second is down to like 30%. And, I work with the public and I'm seeing a lot of people that are just, they've had their 2, but they're not interested in doing anything further than that because they were already told it was more protective than the third is being protected now. So there's a lot of confusing information out there. So do you have any data that actually shows those percentages of, proof of protection of those levels on different vaccines? So that's what a lot of people are looking for. And then the other question is treatment options. There's never been any treatment options mentioned. So, I mean, people are isolating for 5 or 10 days, but what can they be doing for themselves when they're home in those 5 or 10 days rather than just sitting there hoping this COVID goes away?
Certainly. So just give me a second here. I'm going to see if I can find. So the protection levels around 2 doses of an mRNA-based product were done with, let's say, so those would have been done mid-year last year and identified based on the circulating strain. So the circulating strain last year was Delta variant. And we saw after 2 doses, protection from severe, or at least invasive disease of 90 to 95%, which is pretty good. So a few things happened in the interim. 1, immunity drops in individuals. That happens if you've had natural disease. That happens if you've been immunized. 2nd, the virus changed, and that happens. So we saw the emergence of Omicron. So what the phrasing that's been stated is immune escape is a thing, which means it does evade the immune system and it evades previous infection. Those who have had previous infection with Delta, you're going to get reinfected with Omicron. Pretty good chance of that. Now, those that have had the benefit of 2 doses of an mRNA-based product do still have some protection. So 30 to 50% protection, I think, is the current numbers, which highlights that need for a subsequent or at least a 3rd dose, usually being an mRNA-based product, to be able to really help boost that protection level from a background 30 to 50% to as high as 70% against severe or at least invasive disease. Things change. Viruses change. Population level of immunity changes. So that's something that we are very carefully watching. The second question around treatment options. For those that are unimmunized or at least at risk of having severe disease, we do have a monoclonal antibody set that is provided. Dr. Hinshaw outlined yesterday that PCR-based testing is also reserved for those in those age or in those categories to be able to get quick and rapid access to that monoclonal antibody. And Alberta Health Services has stood up a mechanism to be able to help treat those individuals with those monoclonal antibody should they require it. For those that have mild illness, either identified through a rapid antigen test or a PCR-based test, or for those that just have symptoms and they're close contact to somebody with COVID-19, you got to stay home. If immunized, it's for 5 days until you have symptom resolution, whichever is longer. If you've been under immunized or not received the full benefit of immunization, it's 10 days, or until resolution of symptoms, whichever is longer. What can you do in those 10 days? Well, stay away from others, don't infect others, clean, make sure things are clean, make sure you're healthy, monitor your symptoms, get in touch with your family physician to help support what your individual health needs are. Very close monitoring of your respiratory system is going to be something that's very critical. Many of our family physicians are doing virtual visits to help support our patients, so that if you have any questions, you can give HealthLink a call or contact your family physician. In chatting with our family physician group across the zone, they are very much wanting to see their patients virtually, if possible, for any reason, along with COVID, so that our family physicians really have stepped up in their ability to help support the patients really in these tough times. We have a scientific advisory group that's been very active in helping sift through a lot of those facts and myths of COVID care. I know in media we've seen ivermectin, it's useless, it doesn't do anything, not appropriate. Vitamin D, we've had a review of that. Not really beneficial, doesn't really have a place in this environment. And many of the other naturopathic remedies and treatments, and again, don't have a place in this particular environment. So that chatting with their family physician specifically about what other supportive options might be available and useful to an individual is often very much an individual-based discussion. And we really would encourage folks to chat with their family physician about what is right for them or what is most beneficial for them individually.
Thank you for that.
All right, Councillor Mackay.
Yeah, thank you very much, Dr. Sikora. And maybe this will be the final question. Is there any clinical definition of when a pandemic morphs or becomes an endemic? Like, are there?
Oh.
In 5 minutes or less.
It's a full university course on that, Councillor Mackay.
I'm sure there is, but I'm just curious as if there's an actual clinical definition, if there's a medical definition, or if it's how do we determine one becomes the other?
It's a great question. And I think what you're also asking is how is COVID going to be with us into the future? And I think I mean, if I read into that, Councillor Mackay, is that?
Yeah. I mean, we're definitely going to have. I mean, that's how a virus continues to morph. It doesn't want to continue to kill its host, otherwise it just doesn't become a virus anymore. I mean, we keep on moving, and it keeps on morphing, keeps on turning into something. I mean, certainly, I'm not a medical professional, but I've certainly read some information in the sense that, I mean, usually some of the common cold or flus that we're dealing with today started off as very severe viruses years ago, centuries ago. So we're going to always be with COVID, I'm sure, or a COVID variant, but when does it become endemic versus pandemic?
And I think I guess probably a very, very short answer may be once we have a handle on how best we can control it and manage it within our respective systems. And our respective systems encompass an entire global community. So all of our countries working together, all of our provinces, all of our municipalities, all of our respective healthcare systems together, working to help manage what this health risk is. And if we use an example like pandemic 2009, we had an influenza large increase. The following year, we actually had the same virus or very similar virus circulate. In every year subsequent, we've had more and more waves in usually the fall season of what that virus was. Of course, it's changed. We've seen over our experience over the past 2 years, an experience of emergence in a particular region of a SARS-CoV-2, that's COVID-19, spread around the world. We've seen evolution of a different variant. Then we had Delta variant, and now we've had Omicron as a variant. And what's next for the future? And I don't know. What we have together is learnings of how best to manage from a hospitalization critical care perspective. We have some understanding of how to manage from a municipal and a societal perspective of physical social distancing, gathering sizes, perhaps changing social norms around use of face coverings, hand hygiene, and maybe importantly, staying home when you're sick. That's been quite something. We've seen changing norms around how we work together. We're doing a meeting here very effectively over a computer, where 3 years ago, I don't think we would have contemplated that. We have an evolution of vaccines that can go through an approval stage and a revision stage exceptionally quickly. I think I recall reading that some of the manufacturers expect to have an Omicron-specific product out within a month. And in times gone by, it often takes half a year for a manufacturer to change the formulation of, say, an influenza vaccine. So we've seen large strides in how we manage together as society, as a healthcare system, as an education system, as municipal, as government. So I don't know when we'll be able to take away or at least step back from our emergency style of management and really shift this more into regular business, or at least that as you stated, an endemic approach. I think we'll have to have a discussion. It'll have to be a very broad discussion, and I know our province would also be having those discussions with other provinces and likely other countries to be able to help define what is our next steps with this. So I'm sorry I didn't answer your question, Councillor McBride, but hopefully the discussion sort of helped inform what some of those factors may be.
Yeah, no, and I was not anticipating a complete answer, but I mean, I realize the difficulty and challenges. I was just wondering if there's an actual clinical definition, but it doesn't sound like it in the sense that, so thank you very much. I appreciate it. And you know what, one of the observations I made, and it goes to one of your comments that you just made in relation to the quick development of a vaccine that would be unheard of for other potential, I guess, pandemics. I mean, I guess maybe there's opportunities that this will lead to further medical research on other issues and illnesses that maybe kind of, instead of looking at decades out, we're not quite looking quite so far. So
certainly we have been through a great deal of change together, and I think our learnings over the past 2 years will help inform how we get along together into the future, including on the medical research side.
All right, I see no more questions. That was actually a good one to end it on. It was the World Health Organization that made the decision to declare a pandemic, and I assume it'll be their decision to downgrade it. But it is a decision that many factors play into it, I think. So appreciate you joining us. We, as a municipality, are here to support you in any way Alberta Health Services needs. And I think that I could say all municipalities across Alberta would feel the same way. We're here to be your partner in all this. And we will continue to echo the messages you've given today about masking and distancing and staying home and hand washing and all those messages. That's part of our job to continue to communicate it. So thank you for giving us the knowledge so we can appropriately talk to our residents about some of these things.
And likewise, we really do thank and appreciate all of yours and Mr. Janke's help in helping support our citizens and our population in around the St. Albert area. It's amazing work on everyone's part, and this is hard stuff, but these are the things that we have to do and are very dedicated to doing to help support our populations.
Great. Yeah, it is hard stuff, and but I think a lot of heroes have arisen throughout this whole time, including yourself. So have a great day, everyone. I'm going to adjourn our emergency management meeting, and there is nothing scheduled in the future, so we'll just take it when we need it. So thank you again, everyone, for joining. Bye.
Thank you, everyone.